Welcome to my channel, Indian Anatomist. Today we are going to discuss patella fracture, frequently asked in medical postgraduate entrance examinations. Before going to main topic, let us discuss about the anatomy of patella. What is patella? Patella is the largest sesamoid bone in human body, also called as kneecap. It is located in front of the knee, at the patellofemoral notch of the femur. It is linked into the patellar ligament below, and the quadriceps muscles tendon above. The patellar ligament is made up of the tendon, that continues from the quadriceps femoris muscle. Patella is a triangular-shaped sesamoid bone, that originates from the quadriceps femoris muscle. The quadriceps muscle tendon is anchored by the base of the patella, while the patellar ligament is attached to the tibial tuberosity, at its apex. The anterior surface of the patella is free and in contact with the skin, while the posterior surface contains medial smaller and lateral larger facets that align with the medial and lateral condyles of the femur respectively. Now, what are the functions of patella? The patella increases the efficiency of the quadriceps femoris muscle by increasing the leverage that the tendon can apply on the femur. In addition to providing protection, patella shields the anterior aspect of the knee joint from any potential physical harm. Coming back to main part, what is patella fracture? Patella fracture commonly arises after a forceful impact, such as a fall, or a direct blow to the kneecap. Patella fractures can be classified as either simple or complex, also called compound. Some patellar fractures require surgical intervention for repair. The rehabilitation process might be prolonged, and it is common to encounter adverse effects. The patella may sustain a hairline fracture, or fracture into two distinct pieces, or shatter into several smaller fragments depending on the severity of the force applied. Patella fractures can cause the extensor mechanism of the knee joint to no longer function properly. Patellar fracture is frequently the result of a traumatic incident, such as a fall or a kneecap strike, and its behaviors may vary depending on the applied force. Fractures of it may be simple or compound. Certain fractures are surgically reparable. Recovery can be protracted, and adverse effects are prevalent. Now, coming to the types of patella fractures. First type of patella fracture is stable patella fracture. Also called non-displaced fracture, and the fractured bone fragments stay in place. They may still be joined or separated by 1 to 3 millimeters. This fracture normally heals without surgery. If you don't need surgery, the orthopedic surgeon will immobilize the knee in extension with a knee immobilizer, hinged knee brace, or cast. You may carry as much weight as you choose. Second type of patella fracture is displaced patella fracture. If this fracture occurs, the bone fragments are no longer aligned properly, and have moved away from their position. These fragments frequently require surgical intervention to facilitate healing, and restore appropriate functionality to the knee. Now, third type of patella fracture is transverse patella fracture. In this fracture, the patella, or kneecap, splits into two separate pieces. These fractures are frequently repaired with surgical intervention. Multiple surgical procedures can be employed to repair these injuries. The optimal choice will be determined by your orthopedic surgeon. The fourth type of patella fracture is comminuted patella fracture. This occurs when the patella breaks into 3 or more fragments. A comminuted fracture can be categorized as either stable or unstable. In cases when a comminuted fracture is deemed unstable, certain bone fragments may be too small to be rejoined, and hence require surgical removal, called patellectomy. At last, and the fifth type of patella fracture is open patella fracture. These fractures involve either pieces of fractured patella bone have entered the body through the skin, or an external object has penetrated the patella through the skin. Antibiotics and surgery are needed immediately for an open fracture. Open fractures are more likely to infect, so seek medical assistance immediately. Your surgeon will decide how to heal the fracture. To the medicos, I hope you understand about the patellar fractures. Now it's time to talk about the MCQs, about patella fractures that are often found on medical entrance exams, which are: first MCQ is, what is the treatment of choice for a displaced transverse patella fracture? The options are A. Casting, B. Partial patellectomy, C. Plating, and D is tension band wiring. The correct option for this MCQ is D, that is, tension band wiring. Number 2 MCQ is, comminuted fracture of patella is treated by A. Tension band wire, B. Conservative, C. Surgery and immobilization, and D is patellectomy. Correct option is D. Patellectomy. Third MCQ is, recurrent dislocation of patella is most often associated with A. Abnormal low patella, B. Abnormal high patella, C. Bow leg, and D is quadriceps contracture. And the correct option is B. That is, abnormal high patella. The fourth MCQ is, which of the following structures is the least susceptible to harm in knee dislocation? A. Common peroneal nerve, B. Cruciate ligaments, C. Patella, and D is popliteal artery. And the correct option is C. The patella. Fifth MCQ is, the management of a patella fracture in a 24-year-old athlete female is A. No treatment is required, B. POP in full extension, C. Patellectomy, if undisplaced, and D is internal fixation, if comminuted fracture. The correct option is B. POP in full extension. And the last, the sixth MCQ is, the optimal treatment for a transverse fracture of patella in a young patient is A. K-band wiring, following POP cast, B. Bed rest with quadriceps exercises, C. Cylindrical POP cast, and D is patellectomy. And the correct option is A. That is, K-band wiring, following POP cast. Greetings to aspiring medical professionals. I sincerely appreciate your generous assistance towards the Indian Anatomist. Wishing you the utmost success in your promising medical future. Kindly engage with my channel, Indian Anatomist, by liking, commenting, sharing, and subscribing.